What is the purpose of monitoring an IV line? To keep the vein open or for fluid replacement. What is the flow rate to maintain IV patency for a patient less than 12 years of age? 15 milliliters per hour of any isotonic crystalloid solution. What is the flow rate to maintain IV patency for a patient greater than or equal to 12 years of age? 30 to 60 milliliters per hour of any isotonic crystalloid solution. What is the maximum flow rate for fluid replacement? Up to 2 milliliters per hour to a maximum of 200 milliliters per hour. What can be administered through an IV line? Thiamine, multivitamin preparations, drugs within the paramedics level of certification, and potassium chloride for patients greater than or equal to 18 years of age. To a maximum of 10 mg in a 250 milliliters bag. When should a paramedic request a medically responsible escort? What should the paramedic do before transport? What information should be documented on the ambulance call report? Pre-transport IV information. What should be done to monitor and maintain the IV during transport? Maintain prescribed rate, change IV bag as required. What should be done if the IV becomes dislodged or interstitial? Discontinue IV flow, remove catheter with aseptic technique. What should be done to confirm the condition of the catheter if removed? Inspect the catheter. When should the IV bag be changed? When there is approximately 150 ml of solution remaining. What can be infused through an intravenous line for fluid replacement? Thiamine, multivitamin preparations, drugs within the paramedics level of certification, or potassium chloride for patients greater than or equal to 18 years of age. What is the maximum amount of potassium chloride that can be infused in a 250 milliliters bag? 10 mg. What is the maximum flow rate for fluid replacement based on weight? Up to 2 milliliters per hour. What is the maximum flow rate for fluid replacement in ml/hr? 200 milliliters per hour. What is the maximum amount of potassium chloride that can be infused? 10 mg. What is the maximum volume of the bag for potassium chloride infusion? 250 milliliters. What is an allergic reaction? An immune response to a specific substance. What should you consider? Potential life/limb/function threats, such as anaphylaxis. What are common allergen identified in the standard? Penicillin, and other antibiotics. Antipenicillin family latex bee/wasp/hornet venom. Seafood, shrimp, crab, lobster, other shellfish. Nuts, strawberries, melons, eggs, bananas. Sulfites. What should a paramedic do in situations involving a patient with an allergic reaction? Perform a secondary survey to assess 1. The site of allergic reaction, 2. Lungs for adventitious sounds, 3. Skin for erythema, urticaria, edema. Consider anaphylaxis if the patient presents with what? What else is important to consider? Historical findings including difficulty swallowing / tightness in the throat, difficulty breathing / feeling of suffocation, fearfulness, anxiety, agitation, confusion, feeling of doom, generalized itching, history of any body system involvement listed earlier. What potential problems should a paramedic prepare for in situations involving a patient with an allergic reaction? Cardiac arrest, airway obstruction, anaphylaxis, bronchospasm, hypotension. What are extenuating circumstances? Circumstances where complying with the standards is not justified. How should paramedics handle extenuating circumstances? Use knowledge, training, skill, and clinical judgment to mitigate them. What should paramedics do regarding documentation? Document in accordance with the Ontario Ambulance Documentation Standards and the Ambulance Call Report Completion Manual. What are some examples of extenuating circumstances? Scene conditions, overwhelmed resources, equipment failure, safety concerns, patient location, distance from receiving facility, and others not specified. What is an example of a scene condition? Conditions at the location of the incident. What is an example of overwhelmed resources? A multi-casualty incident where resources are insufficient. What is an example of equipment failure? Failure or malfunction of medical equipment. What is an example of safety concerns? Concerns for the safety of the paramedics or the patient. What is an example of patient location? The physical location of the patient. What is an example of distance from receiving facility? The distance between the incident location and the facility where the patient will be received. What is an example of others not specified? Factors that are not explicitly mentioned, such as a language barrier. What is a paramedic? A paramedic is an emergency medical attendant as defined under the Ambulance Act and Regulation 257/00. What is a patient? A patient is an individual for whom a request for ambulance service was made and who a paramedic has made contact with for assessment, care, and/or transport. What is a patient priority system? A patient priority system is a bypass agreement implemented into an ambulance operator's deployment plan according to MO/Central Ambulance Communications Center/Ambulance Communication Service policies. What are guidelines? Guidelines are general statements that provide information and guidance for working assessments or preferred practices in specific clinical circumstances where a standard is not feasible or practical. What is the first standard of paramedic conduct? Conserve life, alleviate pain and suffering, and promote health. What is the second standard of paramedic conduct? Protect and maintain the patient's safety, dignity, and privacy. What is the third standard of paramedic conduct? Provide care based on human need with respect for human dignity. What is the fourth standard of paramedic conduct? Demonstrate empathy and compassion for patients and their families. What is the fifth standard of paramedic conduct? Provide patient care until it is no longer required or until another appropriately qualified healthcare professional has accepted responsibility for patient care. What is the sixth standard of paramedic conduct? Discharge duties with honesty, diligence, efficiency, and integrity. What is the seventh standard of paramedic conduct? Conduct and present oneself in a manner that encourages and merits the respect of the public for members of the paramedic profession. What is the eighth standard of paramedic conduct? Attempt to establish and maintain good working relationships with other professional colleagues and the public. What is the ninth standard of paramedic conduct? Assume responsibility for personal and professional development, including quality assurance initiatives such as reporting patient safety incidents. What is the 10th standard of paramedic conduct? Maintain familiarity with current applicable legislation and practice, and strive to work to the fullest extent of his/her competencies. What is the 11th standard of paramedic conduct? Report any incompetent, illegal, or unethical conduct by colleagues or other healthcare professionals to the ambulance service operator and/or base hospital. What is paramedic misconduct? Practicing beyond one's level of certification. What is paramedic misconduct? Refusing or neglecting to serve persons requiring services that are part of the normal performance of his/her duties. What is paramedic misconduct? Falsifying documentation of any kind. What is paramedic misconduct? Misrepresenting qualifications or credentials. What is paramedic misconduct? Threatening or using violent behavior. What is the definition of unauthorized drug possession? Taking or possessing drugs from the ambulance service without authorization. What is the definition of disclosing confidential information? Sharing identifying information about an individual, personal health information, or non-public information obtained as a paramedic. What is the guideline for paramedics unsure about disclosing confidential information? Refrain from disclosing and consult with ambulance service operator. What is the definition of inappropriate sexual contact with a patient? Engaging in any form of inappropriate sexual contact or relations with a patient. What is the definition of conduct unbecoming of a paramedic? Engaging in any other behavior that is considered inappropriate for a paramedic. What is the first measure a paramedic should take upon receiving a call? Confirm call information with the CCC/ACS. What should a paramedic do while operating the ambulance? Use an appropriate route and speed, adhere to approved driving and occupant restraint policies, and operate the ambulance responsibly. What should a paramedic do upon arrival at the scene? Perform an assessment of the environment, park the ambulance in a safe place, and identify routes of access and egress. What should a paramedic ensure about the call environment? Ensure it is safe with no danger to self or others. What should a paramedic do if there is danger or uncertainty regarding personal and/or patient safety? Request assistance from Allied Emergency Services and maintain communication with CCC/ACS. What equipment should a paramedic bring to the point of initial patient contact? Equipment required to establish baseline vital signs and perform defibrillation. How should a paramedic determine any additional equipment likely to be required? Use call and scene information. What should a paramedic do if there is more than one patient and/or additional resources or assistance is required? Make requests to CCC/ACS. What should a paramedic do regarding personal protective equipment? Utilize it according to the patient care and transportation standards and take appropriate safety measures. How should a paramedic establish patient trust? Use proper, effective communication techniques. What should a paramedic do to protect the patient from hazards and adverse environmental conditions? Take appropriate measures. What should a paramedic do for scene responses involving hazardous materials? Reference the Transport Canada Emergency Response Guidebook. What should a paramedic ensure regarding the use and disposal of equipment? Ensure safe use and disposal, especially for sharps. What should a paramedic do regarding hand hygiene? Perform it as per the patient care and transportation standards. What should a paramedic do to obtain consent for patient care? Obtain consent as per the Health Care Consent Act, 1996. What is the patient assessment standard? Standard for paramedics to assess patients. What should the paramedic assume? Existence of serious, potentially life-threatening conditions. What scene observations should the paramedic make? Observations relevant to the patient's status. What should the paramedic seek? Medical information tags. What information should the paramedic attempt to determine about the patient? Name, sex, age, and weight. What should the paramedic do if other forms of patient identification are required? Make reasonable attempts to seek them. What should the paramedic determine about the patient? Chief complaint. What should the paramedic do immediately on patient contact? Perform the primary survey. What should the paramedic note during the primary survey? General appearance, degree of distress, and CTS. What precautions should the paramedic ensure if applicable? See spine precautions as indicated by the Spinal Motion Restriction Standard. What should the paramedic assess during the primary survey? Airway patency, breathing, circulation, and level of consciousness. What should the paramedic do upon identifying absent/inadequate airway, breathing, circulation, or any other life-threatening concerns? Perform critical interventions as per the patient management standard. What should the paramedic determine about the patient's history? Present illness or incident. What should the paramedic determine about the patient's medical information? Symptoms, allergies, past medical history, and medications. What should the paramedic determine about the patient's compliance? Compliance with prescribed medications. What should the paramedic do if the patient meets the criteria listed in the Load and Go patient standard? Initiate rapid transport and perform further assessment and management en route. What are the baseline vital signs that a paramedic should establish? Heart rate, respiration rate, blood pressure, pulse oximetry, Glasgow Coma Scale, pupils, and skin color and condition. When should a paramedic auscultate the patient's lungs? If the patient is exhibiting signs or symptoms of cardiovascular, respiratory or neurological compromise. When should a paramedic initiate cardiac monitoring? If the patient is exhibiting signs or symptoms of cardiovascular, respiratory or neurological compromise. What types of calls typically warrant a cardiac monitor? When should a paramedic perform a secondary survey? As required by patient status or the standards. When should a paramedic obtain a second set of vital signs? During patient care. When should a paramedic obtain the patient's temperature? If the patient is suspected to be febrile or experiencing hyperthermia. What is a working assessment after the primary and secondary survey? An ongoing evaluation of the patient's condition after initial assessments. When should the paramedic reassess the patient's airway patency, breathing, circulation, level of consciousness? If a critical intervention is provided or there is a change in patient status. What should be considered during a reassessment of the patient? Further patient assessment or management. How often should vital signs be reassessed? At least every 30 minutes. When should vital signs be reassessed more frequently? When required by patient condition, changes to patient status, or the standards. What is patient management? The process of providing care and treatment to a patient. What is a standard? A set of guidelines or protocols that outline the expected actions and procedures. What should a paramedic do if the patient is vital signs absent and meets obvious death criteria? Follow the procedures outlined in the deceased patient standard. What should a paramedic do if the patient has no Do Not Resuscitate confirmation form? Refer to the Do Not Resuscitate standard. What critical interventions should a paramedic perform to establish/improve and maintain airway patency, ventilation, and circulation? Protect C-spine if indicated, initiate CPR, clear airway obstructions, ventilate or assist ventilations, and control trauma-related external hemorrhage. What should a paramedic do if C-spine precautions are indicated? Protect the C-spine according to the Spinal Motion Restriction Standard. What should a paramedic do if the patient is vital signs absent? Initiate cardiopulmonary resuscitation according to current guidelines and cardiac arrest standards. What should a paramedic do to clear airway obstructions? Follow the airway obstruction standard, including suctioning of saliva, blood, and vomit if necessary. When should a paramedic administer oxygen therapy? As per the oxygen therapy standard. What should a paramedic do if the patient has other life, limb, and/or function-threatening conditions? Initiate management as outlined in other sections of the standards and the ALSPCS. What should a paramedic consider when positioning or repositioning the patient? C-spine alignment, airway patency, breathing, venous return and perfusion, extremity injury, and patient comfort. What should be done if the patient is stable? Initiate management on scene for non-critical conditions. What should be done to the patient continuously? Monitor and provide assessment and management as required. When should the patient be given nothing by mouth? Unless indicated by the standards or ALSPCS. What should be ensured regarding the patient's temperature? Maintain a comfortable temperature as required by the standards. What is the role of a paramedic? Determine CTS level and initiate transport. What is CTS? Canadian Triage and Acuity Scale. How does a paramedic determine CTS level? Refer to Pre-Hospital CTS Paramedic Guide. Who confirms or directs the appropriate receiving healthcare facility? Ambulance Communications Officer. What should a paramedic do if confirmation or direction cannot be attained from an ACO? Transport to the closest or most appropriate hospital. What should a paramedic collect and transport for review by receiving facility staff? Relevant patient medications, record of medications, and medical records. What should a paramedic do for inter-facility transfers with care requirements exceeding their level of certification? Request a medically responsible escort from the sending facility. What information/documents should be obtained for inter-facility transfers? Sending physician's name, treatment orders, transfer paper, facility staff names, equipment list, receiving facility and physician. What should a paramedic do for CTS 1 and 2 patients? Move and transport them on a stretcher. What is the purpose of basic life support patient care standards? To provide a general standard of care for paramedics. Who is responsible for the basic life support patient care standards? Emergency Health Regulatory and Accountability Branch, Ontario Ministry of Health. What is the appropriate method of transport for CTS 3 to 5 patients? Using the appropriate lift, carry, or ambulatory assistance. How should inter-facility transfers be conducted? Transporting the patient to and from the ambulance on the stretcher. What should be done to ensure safety inside the ambulance? Securing the patient, stretcher, equipment, and all occupants. What is the responsibility of the healthcare provider during transport? Attending to the patient at all times. What should be done if the patient is under the care of a medical escort or transfer team? Providing support in the patient compartment. What should be done if the patient's condition deteriorates during transport? Transporting the patient to the closest or most appropriate hospital. What should be done if the destination hospital needs to be changed? Immediately notifying CCC/ACS and the new receiving facility. What should be done to maintain patient comfort in the patient compartment? Maintaining temperature and lighting conditions. What is the purpose of using the appropriate lift, carry, or ambulatory assistance? To transport CTS 3 to 5 patients to and from the ambulance. What is the purpose of securing the patient, stretcher, equipment, and all occupants? To ensure safety inside the ambulance. What should be done if the patient's survival to the directed receiving facility is questionable? Transporting the patient to the closest or most appropriate hospital. How can a paramedic confirm if a patient or STM has capacity? Utilize the A2 capacity assessment. What should a paramedic do if a patient or STM refuses to sign the refusal of service section of the ambulance call report? There is no obligation for them to sign it, so document the refusal and reason for not providing a signature. Under what circumstances should a paramedic carry out emergency treatment and transport without consent? If the patient lacks capacity, is experiencing severe suffering or at risk of serious bodily harm if the treatment is not administered. Delay required to obtain consent would prolong suffering or put the patient at risk of sustaining serious bodily harm. What should a paramedic do if they carry out emergency treatment and transport without consent? Document the circumstances that led to the decision. When can a paramedic carry out emergency treatment and transport without consent? What are the reasons for not being able to obtain consent? Language barrier or patient's disability preventing communication. What steps should be taken before administering treatment without consent? Reasonable efforts to find a practical means of communication. What should be done if no practical means of communication is found? Emergency treatment should be administered. What should be considered before administering treatment without consent? The delay in finding a means of communication should not prolong suffering or put the patient at risk. What should be documented by the paramedic? The circumstances that led to the decision of administering treatment without consent. What is the purpose of emergency treatment and transport without consent? To prevent severe suffering or serious bodily harm. What factors may prevent communication for obtaining consent? Language barrier or patient's disability. What should be done if the delay in finding a means of communication will prolong suffering? Emergency treatment should be administered. What should be considered before administering treatment without consent? The patient's preference for treatment. What do you do if patient or caregiver refuses treatment or transfer? What information should be included in the report for CTS-1 and CTS-2 patients? Unit number identification, patient age, patient sex, CTS level, chief complaint, pertinent history, pertinent assessment findings, pertinent management and response to management, abnormal vital signs, estimated time of arrival. What should the paramedic do after transmitting the report? Confirm that the receiving facility or ACO has acknowledged the report. When should additional reports be provided? If the patient's CTS changes to a higher acuity. What is a patch? A communication between a paramedic and a physician. When should a paramedic initiate a patch? When required by the standards or when further direction is desired. What should a paramedic state during the patch? His/her level of certification. Information necessary to convey the patient's condition, situation, or circumstance which requires input. All other information requested by the physician. What should the paramedic confirm during the patch? Direction, authorization, and orders given by the physician. How should the patch be documented? As per the Ontario Ambulance Documentation Standards and the Ambulance Call Report Completion Manual. What is the importance of recognizing the training and qualifications of regulated health professionals? To ensure appropriate collaboration and decision-making in patient care. What should a paramedic do to determine the nature of the request for ambulance services? Assess the situation and gather information. What confirmation should a paramedic obtain regarding the regulated health professional? Confirmation of registration and patient care. What level of assistance should a paramedic provide to a regulated health professional? Only to the level authorized by the paramedic's training. What information should be documented on the ambulance call report? A. Name of the regulated health professional. B. Type of regulated health professional. C. Any care provided by the regulated health professional. What is transfer of care standard? Standard procedure for transferring a patient to a receiving facility. What are the steps for a paramedic upon arrival at the receiving facility? 1. Liaise with receiving facility staff to determine patient's destination. 2. Attend to the patient while awaiting staff acceptance. 3. Provide a verbal report to receiving facility staff. What information should be included in the verbal report to receiving facility staff? Patient name, age, sex, CTS, chief complaint, concise history, assessment findings, management performed, vital signs, and reason for transfer. What should the paramedic provide a copy of to the receiving facility? Any clinically relevant associated biometric data collected. What should the paramedic do if there will be a prolonged delay in accepting the patient? Advise CCC/ACS, advise receiving facility if patient status deteriorates, seek further assistance from ambulance service operator, and/or request receiving staff to contact sending physician or patient's family physician. What should the paramedic do with the patient upon transfer to the receiving facility? Transfer the patient from the stretcher to the receiving facility. What should the paramedic transfer to the receiving facility? Patient medications, record of medications, other relevant identification and medical records, and any other belongings. When is transfer of care considered complete? Upon completion of steps 1 to 7 and when the patient is no longer dependent on ambulance service resources. What are the Ontario Ambulance Service Documentation Standards? Guidelines for documenting patient information in Ontario. What is the process for transferring documentation to the receiving facility? Sending patient records to the appropriate healthcare facility. What is the Ontario Ambulance Documentation Standards? Guidelines for documenting patient care in Ontario. What is the Ambulance Call Report Completion Manual? A manual that provides instructions for completing ambulance call reports. What should the paramedic document regarding clinical response? The paramedic should document the patient's response to treatment and procedures performed. What instances should be documented on the ambulance call report? All instances of threatened violence should be documented. What information should be documented for inter-facility transfers? Pertinent patient history and care information should be documented. What documents should be received and documented for inter-facility transfers? Transfer papers such as case summary, treatment orders, lab work, X-rays, and list of personal effects or belongings should be received and documented. What information should be documented regarding inter-facility transfers? The names of escort, transport team members, and a list of equipment accompanying the patient should be documented. What is patient care equipment use standard? Utilizing equipment as trained and per manufacturer specifications. What is the responsibility of a paramedic regarding equipment use? Using equipment as trained and reporting any problems. What is the goal of oxygen therapy? Maintain oxygen saturation between 92 to 96%. When should high concentration oxygen be continuously administered? Confirmed or suspected carbon monoxide or cyanide toxicity, upper airway burns, scuba diving related disorders, ongoing cardiopulmonary arrest, complete airway obstruction, sickle cell anemia with suspected vaso-occlusive crisis. What should be done if pulse oximetry equipment is not functioning? Administer high concentration oxygen to specified patients and those with critical findings. What are the critical findings that require high concentration oxygen? Age-specific hypotension, respiratory distress, cyanosis, altered level of consciousness, abnormal pregnancy or labor. What oxygen saturation range should be targeted for COPD patients? 88 to 92%. What should be done if pulse oximetry equipment is not functioning for COPD patients? Administer oxygen by nasal cannula with oxygen flow at 2 liters per minute above the patient's home oxygen levels, or 2 liters per minute if patient is not on home oxygen. How often should vital signs be reassessed for COPD patients? Approximately every 10 minutes. What is the recommended action for maintaining oxygen flow rate if the patient's status improves? Maintain oxygen flow rate at that level. How should the oxygen be increased if the patient's status deteriorates or they feel worse? Increase oxygen by increments of 2 liters per minute above starting level approximately every 2 to 3 minutes. What should you be prepared to do in case of emergency? Be prepared to ventilate. What is a regionally designated equivalent hospital? An appropriately resourced hospital facility defined by the Regional Trauma Network. What is transport time? The time from scene departure to arrival at destination. What is a general directive? The procedure followed by paramedics for field triage of trauma patients. What is the purpose of the field trauma triage standard? To assess and determine appropriate care for trauma patients. What is the role of the paramedic in using the field trauma triage standard? To assess patients and determine if they meet the clinical criteria. What is the trauma termination of resuscitation? A directive used for trauma cardiac arrest cases. Who can authorize transport under the field trauma triage standard? CCC/ACS once notified of the patient's need. What is the first step in the field triage procedure? Assessing the patient for physiological criteria. What are the physiological criteria for field triage? Patient not following commands, systolic blood pressure less than 90 mmHg, respiratory rate less than 10 or greater than or equal to 30 breaths per minute, or need for ventilatory support. What is the next step if the patient meets the physiological criteria? Transport the patient directly to a lead trauma hospital or regionally designated equivalent hospital if land transport time is estimated to be less than 30 minutes. What are the anatomical criteria for assessing a patient? What should be done if the patient meets the anatomical criteria and the land transport time is estimated to be less than 30 minutes to the designated hospital? Transport the patient directly to the designated hospital. What should be done if unable to secure the patient's airway or survival to the designated hospital is unlikely? Transport the patient to the closest emergency department. Under what circumstances should the patient be transported directly to the designated hospital despite previous criteria? If the patient has a penetrating trauma to the torso or head/neck and meets the following: A. Vital signs absent yet not subject to TOR described in the General Directive. B. Land transport to the designated hospital is estimated to be less than 30 minutes. What criteria should be used to determine if the patient may require other support services at the designated hospital? Use the traumatic mechanism of injury to assess if other support services may be required. What is considered a fall for adults? Falls greater than or equal to 6 meters. What is considered a fall for children? falls greater than or equal to 3 meters or 2 to 3 times the height of the child. What are the criteria for a high-risk auto crash? I. Intrusion greater than or equal to 0.3 meters occupant site. Greater than or equal to 0.5 meters any site, including the roof. E. Ejection from automobile, i.e. death in the same passenger compartment. If vehicle telemetry data consistent with high-risk injury. What are the criteria for a pedestrian or bicyclist involved in an automobile accident? Thrown, run over or struck with significant impact by an automobile. What are the criteria for a motorcycle crash? Crash greater than or equal to 30 km per hour. What is the time limit for land transport to an LTH or regionally designated equivalent hospital? Estimated to be less than 30 minutes asterisk. What are the special criteria to consider in addition to the mechanism of injury criteria? A. Age. I. Risk of injury/death increases after age 55. E. SBP less than 110 may represent shock after age 65 bits. Anticoagulation and bleeding disorders. C. Burns. I. With trauma mechanism, triage to LTHD. Pregnancy greater than or equal to 20 weeks. What is the time limit for land transport to an LTH or regionally designated equivalent hospital if the patient meets any of the special criteria? Estimated to be less than 30 minutes asterisk. What are the operational criteria for requesting an air ambulance response? What are the clinical criteria for requesting an air ambulance response? Patients meeting criteria listed in field trauma triage standard, or patients with medical conditions such as shock, hypotension with altered mentation, suspected aortic aneurysm rupture, massive gastrointestinal bleed, severe sepsis, anaphylaxis, cardiogenic shock, etc. What is the time frame for an acute stroke with a clearly determined time of onset or last known to be normal? Less than 6 o'clock hours. What is the criteria for an altered level of consciousness? GCS less than 10. What are the indications for acute respiratory failure or distress? Respiratory failure or distress. What are the indications for suspected STEMI or potentially lethal dysrhythmia? Suspected STEMI or potentially lethal dysrhythmia. What are the indications for resuscitation from respiratory or cardiac arrest? Resuscitation from respiratory or cardiac arrest. What are the indications for status epilepticus? Status epilepticus. What are the indications for an unstable airway or partial airway obstruction? Unstable airway or partial airway obstruction. What are the indications for active labor with abnormal presentation? Active labor with abnormal presentation. What are the indications for multiple gestation and active labor? Multiple gestation and active labor. What are the indications for umbilical cord prolapse? Umbilical cord prolapse. What are the indications for significant vaginal bleeding? Significant vaginal bleeding. What are the criteria for requesting an on-scene air ambulance helicopter? Perceived severity of reported injuries or patient cannot be reached by land ambulance. What information should be provided to the ACO when requesting an on-scene air ambulance helicopter? Estimated time to prepare patient for transport, time required for patient extrication, estimated land ambulance driving time to closest appropriate hospital, and any additional information as required. What is the criteria for delaying patient transport for the air ambulance helicopter? Only if the helicopter is on its final approach to the scene. What should the land ambulance do if the air ambulance helicopter is en route but not on final approach? Proceed to the closest local hospital with an emergency department. What should the air ambulance helicopter do if the land paramedics have the patient in their ambulance? Proceed to the closest local hospital and assist hospital personnel if appropriate. Under what circumstances can paramedics rendezvous with the air ambulance helicopter? If the helicopter can land along the direct route of the land ambulance, and it significantly reduces transport time to the most appropriate hospital. What should paramedics do if the call circumstances and patient do not meet the criteria for an air ambulance helicopter response? Contact the CACC/ACS and advise that an on-scene air ambulance helicopter response is not required. What guidelines should paramedics follow when the air ambulance helicopter is responding? The guidelines set out by the Orange Aviation Safety Department. Where can the guidelines for air ambulance helicopter safety be found? On Orange's aircraft safety website at https://www.orange.ca/aircraft-safety. What are the restrictions for air ambulance helicopters during night calls? Cannot land at non-night licensed airports, helipads, or remote landing sites. Are air ambulance helicopters allowed to conduct search and rescue calls? No, they are not permitted. What happens if a land ambulance can reach the patient and an air ambulance response is appropriate? Land ambulance is assigned and continues until flight crew cancels. What should paramedics do if a land ambulance arrives on scene before the air ambulance? Inform CACC/ACS of clinical events. What is spinal motion restriction standard? Standard for potential spine or spinal cord injury. What are some mechanisms of injury that may require SMR? Trauma, sports accidents, diving incidents, explosions, falls, pedestrian struck, electrocution, lightning strikes, penetrating trauma. What are the risk criteria for determining if a patient needs SMR? Neck or back pain, spine tenderness, neurologic signs or symptoms, altered level of consciousness, suspected drug or alcohol intoxication, distracting painful injury, anatomic deformity of the spine, high energy mechanism of injury, age greater than or equal to 65 years old. What is an example of a high-energy mechanism of injury? Motor vehicle collisions, falls from elevation, axial load to the head, being hit by a bus or large truck, collision with motorized/ATV recreational vehicles, bicyclist struck or collision. When should SMR not be applied? When the patient meets the criteria for potential spine or spinal cord injury but does not meet the risk criteria. What is SMR? Spinal motion restriction. When should a cervical collar be used? When the patient meets the requirements of paragraph 2. What should be done to minimize spinal movement? Apply SMR using a cervical collar and secure the patient to the stretcher with stretcher straps. What other devices may be used to minimize spinal movement? Spinal boards or adjustable breakaway stretchers. When should spinal boards or adjustable breakaway stretchers be used? When there is a need to minimize spinal movement during extrication. What should be done if the patient has penetrating trauma to the head, neck, or torso? Determine if the patient exhibits no spine tenderness, no neurologic signs or symptoms, no altered level of consciousness, no evidence of drug or alcohol intoxication, no distracting painful injury, and no anatomic deformity of the spine. When should SMR not be applied? When the patient meets the criteria of paragraph 5. What does the guideline state about clearing the spine for blunt trauma patients? The guideline does not allow the paramedic to clear the spine for blunt trauma patients. It identifies patients where the mechanism of injury in combination with the absence of risk criteria mean a spine injury does not have to be considered. What does using SMR mean for blunt trauma patients? Using SMR does not mean the paramedic has cleared the spine. The paramedic must at all times manage the patient to minimize spinal movement. What should be documented in conjunction with the documentation of patient care standard? The neurologic status before and after SMR on the ambulance call report. What is the purpose of spinal boards? To minimize spinal movement during patient care. What is the purpose of adjustable breakaway stretchers? To minimize spinal movement during extrication. What is the purpose of the cervical collar? To apply SMR and minimize spinal movement. What is the purpose of stretcher straps? To secure the patient to the stretcher during SMR. What is considered when determining if SMR should be applied? The patient's spine tenderness, neurologic signs or symptoms, altered level of consciousness, evidence of drug or alcohol intoxication, distracting painful injury, and anatomic deformity of the spine. What is the purpose of SMR? To restrict spinal motion,